An average of 75 women in Illinois die each year while pregnant or within 1 year of pregnancy. That's according to a new report on maternal morbidity and mortality from the Illinois Department of Public Health. Among the report's most shocking findings, 83% of all pregnancy-related deaths were potentially preventable. And the report also highlighted the impact of systemic racism, finding that Black women were about 3 times more likely to die from a pregnancy-related condition than white women. Joining us now are the 2 experts who helped put this report together: Shannon Leitner, Deputy Director of the Illinois Department of Public Health's Office of Women's Health and Family Services, and Dr. Robin Jones, Chair of the IDPH's Maternal Mortality Review Committee. Jones is also an obstetrician gynecologist at Rush University Medical Center. Thanks to you both for joining us. Shannon Leitner, let's start with you, please. Before we get into the substance of the report, I want to clarify the distinction between pregnancy-associated deaths and pregnancy-related deaths, because you analyze both in your report. What's that difference, please?
Yeah, pregnancy-associated means the death of a woman who is pregnant or 1 year postpartum from any cause. Pregnancy-related is the death of a woman while pregnant or within 1 year of her pregnancy whose death is directly related to her pregnancy. In other words, we ask, would she have died if she had not been pregnant?
Okay. So among the key findings of the report, 34% of women who died either while pregnant or within a year of pregnancy died from a pregnancy-related cause. Of those women, some 40% had some sort of mental health issue. Black women are 3 times more likely to die than white women of a pregnancy-related issue. And women on Medicaid, rather than private insurance, were 3 times more likely to die within 1 year of pregnancy. Dr. Jones, help us to understand those numbers, please. And what clear disparities do you see there?
Thank you. Well, let me start by saying that Black women are more likely to die from a pregnancy-related medical cause than white women. White women are more likely to die from a mental health cause than Black or Hispanic women. And when you look at the causes of death, the top 4 include mental health disorders, pre-existing chronic medical disease, hemorrhage, and hypertension. But understand that we know that there are other factors that contribute to the death of these women, particularly Black women.
Okay, and I think we're going to come back to some of those as well. Shannon Leitner, the report estimated that 83% of pregnancy-related deaths could have potentially been prevented. Why are we as a society failing those women? Why weren't they prevented?
Well, one thing to just clarify is that when we determine a case to be preventable, we mean that there was some chance that the death could have been avoided if reasonable changes could have been made at the provider, hospital, community systems, or patient levels. And it's important to recognize that among these preventable deaths, the chance of preventing that death could range from a very good chance to slight chance to, it was pretty preventable. So the numbers and types of factors that contribute to each case greatly influence the chance of preventability. Some of these cases, we see societal factors playing a huge role: barriers to care such as childcare, transportation, lack of access to care, and then sometimes we see just poor quality of care. So it really does depend on each situation, each case, and the number of factors that really could have been playing a role in preventability.
A number of factors, then not all of them are necessarily within the healthcare setting.
Correct.
Okay. Dr. Jones, this is the second state report on maternal morbidity and mortality. The first in 2018 found that Black women were then 6 times more likely to die of a pregnancy-related condition than white women. The gap has shrunk, but it's you all are saying it's not exactly a sign of progress. Why not?
Well, like I said, we have partnered with the CDC and looking at factors other than or in addition to medical factors. So we're looking at social determinants of health, and we're looking at structural racism. And actually, the CDC has led the way in this work. And across the state, they have provided states with the framework to look at factors such as discrimination and interpersonal racism.
And Dr. Jones, you've also talked about the unacceptable disparities that the report has identified and that role of systemic racism. Explain some of the ways that that systemic racism is impacting the health of Black and brown women.
We have started over the last year at looking at social determinants of health. And until we have a better understanding of how social determinants of health, poverty, quality education, healthy food, income, how that actually affects a woman's health and her access to needed health care, healthcare doesn't exist in a silo. So we'll have to address those factors and understand those factors and then make recommendations that will address the social determinants of health, because they're definitely impacting what we're seeing in our healthcare system.
Shannon Leitner, how would you compare Illinois to other states on these issues?
I think that Illinois is definitely a leader in trying to understand maternal mortality, understand the drivers of what's leading maternal mortality, and putting our recommendations out there. Our report is held up as an example for other states to look to especially, we were the first state to actually name racism as a cause of maternal mortality. And then this report, as you mentioned, dives into structural racism, highlighting redlining as a contributing factor, as a concrete example of how structural racism contributes to maternal mortality. So I think we are leading the way in trying to identify the causes. In putting our recommendations out there in 2018, we recommended that Medicaid be extended to 1 year postpartum, and that was just accomplished. We became the first state to have Medicaid extended to 1 year postpartum for continuous eligibility, with CMS approving our waiver. So I think we are leading the way, but we have a long way to go because that disparity does need to be addressed.
More work to be done, and something I'm sure we'll continue talking about. Dr. Robin Jones and Shannon Leitner, thank you so much for joining us.
Thank you.
Thank you.